In March 2020, COVID-19 forced the United Kingdom into a national lockdown.
Guy's and St Thomas's charity asked the Social Innovation Partnership's community research team to uncover how the pandemic was impacting communities in Lambeth and Southwark.
We interviewed 40 residents, including those with pre-existing health conditions, single parents, those in precarious work, and those with no recourse to public funds.
We spoke with them every 2 weeks over a 4-month period to understand how they were coping during this time.
Here are some of our findings.
During the lockdown, many people had limited access to services or no access at all. People were relying a lot more on their social support network, friends and family, because some of them couldn't actually go out. Some got support from their neighbours and supported each other, but some said their neighbours were not so friendly and kind of withdrew from them. People were especially challenged by the fact that they were isolated from their family, and they connected online a lot, the ones that couldn't physically see their family.
Many people are skeptical about the government and the NHS's inconsistent advice, and they feel that those in power don't necessarily have what's best for them at heart. Because people aren't sure what guidelines to trust and what guidelines to follow, they're making their own decisions. So they might be taking varying degrees of precaution when dealing with COVID. Because of this, there's a wide range of responses to the same COVID-19 guidelines.
Some of my interviewees had expressed a frustration at certain life opportunities having to be cancelled. And this sense of frustration was the catalyst for my interviewees to be more resourceful with their time and to be more resourceful with whatever furlough or finances that they had had. Positive opportunities for the people I had interviewed were of the ilk of self-development, improving on health and fitness, establishing e-commerce. I found that the people best able to take on board the opportunities were people that didn't have children, people that didn't have family to look after, that had the freedom and the time.
So the pandemic, and the lockdown in particular, has had a huge impact on people in terms of their mental health. A lot of the people we spoke to reported feelings of anxiety, depression, loneliness, isolation, and also fear. The situation with the global racial tensions as well compounded those feelings. There's a lot of distrust and mistrust of health systems and health services. Some of the ways in which people have sought to mitigate against that is via developing self-help therapies, spending more time with family. A lot of people are using other sort of maybe herbal remedies as well.
One of the issues that we came across was that not everybody is entitled to government support. Some people didn't understand the process and therefore their claims weren't being processed in a correct way. Some people didn't know that they were entitled to apply. Others found that when they did apply, they were told no. Food poverty was an issue. I know that a number of them were using food banks on a fairly regular basis. It's interesting because I'm also aware that some people who weren't too badly off at the beginning, the longer this went on, they started to struggle.
We have several recommendations for Guy's and St Thomas charity and others as well. These will help them test and explore the right interventions to address the specific issues community members are now facing. Here are some of them.
Funders must seek out and support trusted existing mutual aid groups, particularly those that are set up and run by the Black community, as well as provide funding and professional development opportunities for Black leaders and residents who are interested in setting up these groups to support their communities.
With rapidly changing COVID-19 guidelines, healthcare providers, funders, and organizations need to invest in messaging that local communities trust. This might look like community nurses holding drop-in Q&A sessions about COVID-19 safety in partnership with community organizations in local spaces.
Funders can help tech-savvy young people apply their skills in a more community-oriented way. For example, by connecting young entrepreneurs who are digitally literate with established community businesses that need help getting online.
Funders should work with government bodies to expand the availability of culturally informed, diverse, and easy to access mental and physical health services. They should also work to encourage public dialogue between health professionals on one hand and alternative treatment providers on the other. This will help people make informed health and lifestyle decisions, and also to navigate the options for complementary therapies.
Local and national funders should collaborate with local authorities to support food schemes that will benefit those still shielding and those who are in precarious financial positions because of the pandemic.